The American Migraine Association estimates that 39 million people in the U.S. suffer from migraines. For those suffering, the physical therapies can provide relief from those with migraine attacks. I'm Dan Sellers, physical therapist.
And I'm Gabby Smith, physical therapist assistant at Salina Regional Outpatient Physical Therapy.
Well, Gabby and Dan, thank you so much for joining me today. You know, before talking to you before the taping, I had no idea that PT really could offer some relief for migraine sufferers. Why don't you talk about how that happens?
Yeah, we look at a bunch of different things whenever patients come in. We look at breathing, posture, neck strengthening. We use different modalities such as dry needling and various things to help treat the symptoms that present with migraines.
Yeah, we also use like cervical, manual or mechanical traction, A-stim. Those are just a couple more that I can think to add.
Okay. Well, Dan, you mentioned dry needling, and I know that's something that you are qualified to do. Why don't you talk about how that works?
So we use a monofilament needle to treat trigger points or knots or points of tension in the neck whenever I evaluate patients. So we identify certain muscle groups in the cervical spine that have knots or tension. I utilize the dry needles and we go in, release the tension, and then from there we'll do different approaches. We can use stretching, we can use breathing techniques to help utilize the nervous system to help calm the muscles down, to help relieve the symptoms.
Gabby, you had mentioned A-stim. Why don't you fill the audience in what A-stim is and how that works?
Yeah, so A-stim is a soft tissue mobilization technique. It uses specialized tools along the skin. The goal of it is just to decrease muscle tension, tightness, improve blood flow to the area, promote healthy tissue healing to the areas treated. And it's cool because it's a non-invasive treatment, unlike dry needling is pretty invasive, but with the A-stim, you know, we can get similar relief from it as well without having, you know, to actually go into the muscle. It's just on top of it.
Are we talking about people who are, you know, currently suffering a migraine, or maybe somebody who has chronic migraines, and to teach them how to take care of it when they have one?
So we see patients during all stages of migraine attacks. We see the chronic, we see the acute flare-ups, and the interventions we utilize help complement the medicines that the doctors prescribe.
Okay. Well, thank you so much for some great information, and thank you for watching. For more information, you may visit the Outpatient Physical Therapy page of srhc.com, like us on Facebook, follow us on X and Instagram.